This combination of vitamins and selected minerals is used to prevent or treat vitamin deficiency due to poor eating habits, problems that affect the body's ability to absorb nutrition from food, or increased need for vitamins and minerals due to stress or illness. Vitamins are needed for the body to function well. This vitamin/mineral combination contains high levels of B vitamins, such as folic acid, niacin, B1, B2, B6, and B12, and vitamin C. It also contains other vitamins, A, D, and E, and minerals such as zinc. This medication does not contain iron and has only a small amount of calcium. It should not be used to treat iron-poor blood, anemia, or to prevent osteoporosis. To take Theramill Forte, you can swallow it with or without food, as your doctor tells you. Normally, you take it once or twice a day. If it upsets your stomach, eating with it might help. If you're also taking certain antibiotics, like tetracyclines, quinolones such as ciprofloxacin, take Theramill Forte 2 to 3 hours before or after the antibiotic. The minerals in Theramill Forte might stop the antibiotic from working properly. Side effects of Theramill Forte may include nausea, stomach upset, diarrhea, flushing and unpleasant taste. If any of these effects last or get worse, notify your doctor or pharmacist promptly. If your doctor has prescribed this medication, remember that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including mental/mood changes and unusual weakness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, and trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking Theramill Forte, make sure to inform your doctor or pharmacist about any allergies you may have, especially to folic acid. It's important to also let them know about your medical history, including any blood, calcium, kidney, or liver issues. This medication is not recommended for children under 12, and if you're pregnant or breastfeeding, be sure to talk to your doctor before using it. It's important to be aware that Theramill Forte may interact with other drugs, which could potentially change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Theramill Forte include altretamine, cisplatin, levodopa, hydantoins, such as phenytoin, methotrexate, and pyrimethamine. If someone takes too much Theramill Forte and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they should call a poison control center right away. In the U.S., they can call their local poison control center at 1-800-222-1222. In Canada, they can call a provincial poison control center. Symptoms of overuse may include symptoms of liver disease, kidney disease, bone pain, mental/mood changes, and severe headache. Make sure to attend all your medical appointments and any lab appointments as well. It's important to get your vitamins and minerals from healthy foods, like leafy greens, vegetables, and citrus fruits. Also, you can find folic acid in enriched grains like bread, pasta, and cereal. Remember to maintain a well-balanced diet and follow any dietary guidelines given by your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just wait and take the next one as scheduled. Don't take double the dose to make up for the missed one. Keep Theramill Forte at room temperature, away from light and moisture. Make sure to keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless you are told to do so. When the product expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.